One of the things I've heard too over time as families or healthcare professionals, when we think about entering into a ritual or making space for one, you know, if I go there, is it going to be too much? If I let myself be vulnerable and enter into that ritual, what if I can't stay for the whole thing? Or what if it brings me to a place where it's just too much, or I get stuck, or and that I always, I think, hope to respond to when people are sharing something that vulnerable, to say, I am so glad you helped me to know that is what you're thinking about. And I'm because that's something that we should think about then as we're planning this ritual. But if a moment arises and it feels too much, I think that's something we say honestly. And I think you can leave that as a health professional, as you're setting, without pointing fingers. Maybe if that was something very tender that perhaps a mother shared with you, or a grandparent, or the child themselves shared with you, that to be able to say, we're going to frame this time together. This is a safe space. It's going to mean different things to us, each of us, as it unfolds. And we're going to trust and care about each other enough to know if someone needs to step away, that's okay, so that you can do that as kind of the framing of those more thought out, here's our beginning, middle, and end kind of rituals, versus those in the moments. There have been times where I've excused myself. I've helped a family figure out how they want to honor a tender moment, and it becomes so intimate between them with their feelings, or wherever I can tell they're going, or it's taken them to another zone, that I remove myself and I say, I will be back shortly, right? Not to abandon them, but to honor that tender place. And so no matter what rises up, if it's that kind of heightened, for lack of a better word, or it's a more sedate, or people are very quiet afterwards, finding time at some point to debrief. For healthcare professionals, that's really important, that we're doing that separate from the family. Did that go like we expected? What did we learn? What was unexpected? How was that for us? And do you think that met what the family asked us to provide for them? And when we're doing that with families, talking through, how was that experience? I do not want to ever intrude, or um, have them share things that, I'll frame it somehow, right? That I know what probably happened in that ritual is very personal. But if there's things that you would like me to know about it, as we continue to be together, and I continue to care for you and your family, I would welcome that. So always thinking through, did it meet expectations? Were there aspects of it that were helpful or surprised us, or that we took away, or things that need attention by something other than ritual, that there's other resources that can help with that, if that makes sense. And that has happened before, that I've worked with a family and a ritual's unfolded, and their grief has been such, or it connected them with something they didn't even know, but helped them to give words to it. And I need to find someone else that I can work through this with, if that makes sense. So when it's a ritual even if it's a spur of the moment, like honoring a moment, to think back, even in a very gentle way, how was that for you? Did that meet what you were hoping to accomplish in that moment? Is it in itself its own form of debriefing? And I think a really important component that should be um, a part of our experience of ritual.